Hello everyone, am I audible?
Ma'am.
Okay. Hello everyone, I'm Dr. Sumbal Ijaz, MRCG mentor at Med Institutes. How's everyone doing? Okay, so in today's session, we have arranged this session especially for the IMGs who are very much confused regarding their future plans. We have been receiving these questions like which pathway is most suitable for us, like should we follow MRCG pathway, which is a specialist pathway, and there are some students, candidates, which are really confused whether they are going to choose PLAB journey or not. So today's session is all about to address all of your queries. And just to make this session most insightful, we have also invited Dr. Jeevan, who is currently working in NHS healthcare system. And he has a worth of experience, the first-hand experience regarding the PLAB journey and how everything works in the NHS. So grab your notebook and make sure to bring maximum to utilize this session and utilize your time with the maximum. So whether are you planning to complete your specialization in obs and gynae, or whether you simply want to choose PLAB and get the GMC registration and want to practice in the UK, so this session is for you. So what I'm going to do, I'm going to explain you everything regarding MRCOG, like what is the structure of the exam, what time duration is needed to pass the exams, and in how much time you will get your GMC registration, how much fees are required, and most importantly, what are the job prospects which are available globally. So that you can make a sound decision which career pathway is best for you. So let's begin. In the beginning, I'm just simply going to explain you what is MRCOG. So the purpose of today's session is basically the doctors who really want to work in the UK, there is a one mandatory requirement, which is GMC registration. So what is GMC registration? It is basically the General Medical Council is the regulatory body for the doctors in the UK. And that means the one should have the GMC registration if he or she wants to practice in the UK. But how can I obtain GMC registration? This is the question. So for IMGs, the routes to get their GMC registration, there's PLAB route, which is now known as UKMLA. Then we have acceptable post-grad exams like MRCP, MRCS, MRCOG. And there's another route, which is MTI sponsorship, which varies from country to country. So my focus would be on the MRCOG, which is the post-grad exam. And once you clear your MRCOG exam, then definitely you will grant it by GMC. That means now you're ready to practice in the UK. Is everyone with me? Please do let me know if everyone is following me or not. Okay, let's move on. What is MRCOG? So I'm going to begin from the very basics, so that the candidates who are new here, who do not have any orientation regarding this postgrad exam. So I'm going to explain a bit by bit. So exactly, MRCOG is the membership exam of the Royal College of Obs and Gynae. That means if you are done with your MRCOG Part 1, 2, and 3, you will be granted by a membership by the RCOG. This exam is classically consists of 3 parts. The part 1 is it is a written exam, which mainly involves your basic subjects. Then in the part 2 exam, it is also a written exam, which mainly involves your clinical knowledge and how you can implement that clinical information on the clinical scenarios. So this is a kind of very, it is like specialty level exam. Then we have part 3. It is an OSCE type exam in which they classically assess you on the basis of your communication skills, your knowledge, and how you can counsel the patients. So this is all about MRCOG. That means if you want to pursue this pathway, you need to keep in your mind, you need to clear all of these 3 parts. Am I clear so far? Okay, so the next slide is regarding MRCOG eligibility criteria. So this is one of the most frequently asked questions by the students. Literally, my DM is always loaded with such questions like, are we eligible for part 1? Are we eligible for part 2? There is a lot of confusion among the candidates. So let me clear this today. And I have taken these references from the RCOG website. So for part 1, you must have a medical degree, which is MBBS or equivalent, recognized by the GMC. Then you do not need any clinical experience in obs and gynae to take part 1. So please, I'm repeating this again. There is no need to have any kind of clinical experience in obs and gynae to take part 1. That means if you are just done with your house job, maybe your graduation, you can simply apply for your eligibility and you can appear in MRCOG Part 1 exam. You can sit for Part 1 while still in your internship or immediately after graduation. Then most of the candidates, they are really confused in the eligibility regarding MRCOG Part 2 exam, because previously the RCOG used, they asked for at least 2 years clinical experience in obs and gynae. But now that the rules are different, they have updated the criteria for Part 2. And according to the updated criteria, in order to be eligible to sit in the MRCOG Part 2 exam, candidates must first have sat in past the MRCOG Part 1 exam. That's the only eligibility criteria for Part 2. Is everyone clear now? So it is worth repeating that there's no need of clinical experience if you want to apply for MRCOG Part 2 exam. Then we have the third part. The eligibility for the MRCOG Part 3 is the assessment of training, which classically means that the RCOG wants to assess your clinical knowledge, your clinical experience. For that, they have a form on their website. You just have to download that form, then get that form signed by your supervisor, and get the certificate that you have the 4 years clinical experience in obs and gynae. That's it. So a minimum of 4 years clinical experience is required in order to sit in the MRCOG Part 3. And one more thing I want to highlight here. Candidates can apply to have their training assessed at any time after passing the MRCOG Part 1 exam. So this is something for those candidates who have already done with their training. They are already consultant in their hometown, and they have passed their MRCOG Part 1 exam. They can simply apply for the assessment of training. So there is no limitation that you can only apply for assessment of training after passing Part 2. That is not the case here. So this is all about the eligibility of the MRCOG. If anyone have any question regarding the eligibility criteria, you may ask me anytime. Okay. Okay, so the next frequently asked question by the candidates are, the question is, how many years are required to complete MRCOG? So I have categorized the candidates into 2 categories. Those candidates who are done with their specialty training, like they are done with the CPS, MS, or any residency program in your hometown. This slide is for you. Please listen carefully. If you are, I'm repeating, if you are done with your clinical experience, which is minimum of 4 years clinical experience in the obs and gynae, then for you, the duration for MRCOG is almost around 2.5 years. So this is the window. You can easily complete all the 3 exams and you can get your GMC. And I have divided the time period. Estimated duration to complete MRCOG for those candidates who already have done their training. So you can give part 1 exam in the period of 6 months to 8 months, considering your work routine as well. Since at the senior post, you have more working hours, you need to do surgery to be there for the patients and for the rounds. So the ideal time for you is 6 months to 8 months with job. Then for the part 2, it requires 6 months to 1 or 1.5 years maybe, depending on the nature of your job you are currently doing. And it can be also prepared alongside your clinical work. So basically, the part 2 exam is more about your clinical knowledge in obs and gynae. So if you start studying for MRCG part 2 exam alongside your clinical work, it would benefit you in your clinical practice as well. You will frequently updated by the guidelines. So your practicing, if you are doing your practice in your hometown, that would definitely get improved. And similarly, by the clinical implication of those guidelines would help you to memorize the guidelines, and that would be benefit in your exam. So it is a win-win situation if you do that. Once you're done with your part 2, then for the part 3, for me, I think part 3 exam is the most easiest step of the MRCOG. So it usually requires 3 to 6 months. So the total time, if you pass the exams on your first attempt, you can easily have your complete MRCOG within the period of 2 and 2.5 years. Okay, yes, Nayab, you may ask your question.
Ma'am, right now I know it's too early to ask this, but because we are preparing for our MRCOG part 1, but considering regarding the training, ma'am, for a person like me who is doing a government job, like a regular WMO job, how can we get training after MRCOG part 1 in obs and gynae? Like, do we have to be rolled in a structured obs and gynae training, or we can do in a private practice or something like this?
Well, that's a very valid concern, and I absolutely got your concern. So, may I ask what is the nature of your job you are currently doing? Is it an obs and gynae job, or is it some regular GP training like sort of?
No, ma'am. Actually, I did periphery for 3 years in some periphery suburbs, and there I did gynae job. I conducted deliveries and all that. But right now, I am in a tertiary care hospital where I am in administration, and it is totally against our consent. They like do assign us the job they want.
Understand that. Basically, what happens? Classic. If you get the training, if you have the 4 year structured clinical training experience, that would be the best. But the second thing is that if you are doing the regular MO sort of job, but yes, if you are doing that job in obs and gynae department, that would be definitely beneficial for you. And the third thing is that in assessment of training form, they classically ask you to sign that form by your supervisor. If you are doing a non-training job, but you are working in obs and gynae department, and the nature of your job and your task is equivalent to the trainee post, then definitely, and if you have a supervisor, if you are lucky enough to get a supervisor who can sign your assessment of training form, then definitely that would be work for you. Okay, Fatma, don't worry. MRCOG3 is the most easiest step. I don't know why, but I think that it is easy. Because once you are done with your part 2, there is nothing left to study for obs and gynae. You know everything. So for part 3, the only thing which is we are not familiar with that, you may say, it is your communication skills, where we usually lag, especially the IMGs. We have this problem. We usually, due to our bilingual, we are not native English speaker. So that is a challenging thing, but that is not, you may say, it is not impossible. So don't worry. I think it is quite reassuring for you. Yes, part two, yes, indeed, part 2 is difficult. But again, it is not impossible. There are many, many, many doctors who have their MRCOG, even they are done with their FRCOG as well. So everything is possible if you know the proper strategies, if you remain consistent, and if you know how to study smartly and you are dedicated. So everything is possible. Okay, Dr. Jeevan is here for the PLAB route. He will answer your question soon. Okay, let me finish first. Okay, this is a slide for those candidates who are beginners or just starting their career in obs and gynae. And this applies to those doctors who are fresh graduates and doctors with little or no obs and gynae clinical experience. So the estimated duration to complete MRCOG, and one thing to note down here, you will need to build your clinical experience alongside your exam preparation. Okay, so maybe you are going to opt any structured training obs and gynae program, or maybe training equivalent non-training post. So for the part one, you can easily clear your part one exam in 4 months to 6 months duration. That is more than enough for you. Then for part two, I have just extended the period for 1 to 2 years, since considering the nature of the difficulty of this exam. 1 to 2 years, it is more than enough to pass the exam. And it is also can be done during training or if you are doing any job. So it is plenty amount of time. Then for part three, it is similar for both who are consultant and who are the beginners. 3 to 6 months, again, it is more than enough. And after part two and completing your 4-year clinical experience, definitely then you are eligible to sit in the part three exam. So for you, the time duration is 5 to 5.5 years if exams are passed in the first attempt. Okay, Dr. Vijay, that's really nice. What you can do, you can simply give it to a try. Try to fill your assessment of training form and submit that to RCOG if you are done with your MRCOG Part 1 exam. In that way, you will get a reassurance on time that is this clinical experience is acceptable by the RCOG or not. So this is the safest option you can do. This is another frequently asked question. What is the exam fee? So I have listed the exam fees of part 1, part 2, and part 3. So whenever we are going to check our fee, we need to check in which country, in which band does our home country lies. So for my hometown is my home country is Pakistan. So Pakistan lies in band B. So for me, the fee for part 1 is £572. For part 2, it is £572, and for part 3, it is £883, which roughly makes around £2,000 for all of these exams. So it is up to you. You need to check your band, your country, in which band it lies, and then check your fee over there. So this is how you can calculate the total amount you need to get your complete MRCOG. Okay, what happens once you have cleared all parts of MRCOG? So the next thing you need to do is to apply for your GMC registration. This is the final step. But before that, you need to provide them with your English speaking evidence, which maybe you can go with the OET or IELTS. So once you're done with that, you can apply for the GMC registration. And once you have GMC registration, now many career pathways, job opportunities are open for you. The good thing about MRCOG pathway is that there is not much saturation in this specialty. So there are a lot of vacancies are available. And if you have the membership of Royal College of Obs and Gynae, then definitely your resume would be far better than other candidates. So definitely it would give you an edge, and you can easily get any job in the UK. So once, okay, now this is the point where I want to emphasize you. I want to think in a very vast way. Since I understand it is a long journey, like for maybe 2.5 years, maybe 5.5 years, but is this journey really fruitful? Is it worth it to spend your 5.5 years and £2,000 on this journey? So my answer is yes, definitely, because there is no much saturation in this pathway. So definitely the chances for you to get a job in the NHS is very high. So once you have your GMC registration and now you have your registration in your hand, and classically, you have two categories of jobs in front of you. Either you may enter into training pathway, and there is another pathway which is a non-training pathway. So let me give you a very small overview what is training and non-training pathway. I just want to, why I'm explaining bit by bit, because I want to make sure you understand the nature of the exam, the fee required, the time required, then what are the job prospects, what is your future in terms of your career goals, so that you can take a sound decision and a full informed decision. So that's why you should be knowing what type of job categories you might encounter after having your MRCOG. So training pathway, it is very simple to understand. It is simply a training program. This is similar to your hometown training, specialty training pathway. What are the benefits of entering into training pathway? It is a clear career progression, structured training and mentorship and educational support would be there. And your eligibility for specialist registration upon completion. What is non-training pathway? Okay, in non-training pathway, the pay rank is similar, but there would be less career progression in this pathway, and the job would be less hectic. So it is good for those who want to maintain a healthy work and personal life balance. So non-training pathway is suitable for them, and you can easily ace any job, non-training job in the UK if you have MRCOG. Okay, the training pathway itself is a job. You will get paid. But to enter into the training pathway, you need to give another exam, which is MSRA. But for non-training pathway, there is no further exam is required. You can simply start filling your applications and you may start applying for the jobs. So both are paid and both have similar pay scale. Are you clear now? Okay, MRCPI is comparatively easier than MRCOG, but there is a difference. MRCOG is globally recognized. Although MRCPI is also a good option, but if we compare the global recognition, the MRCOG holds a way more worth than MRCPI. Okay, so what would be your pay, the salary range? Okay, let me explain you first the job ranks. We have a consultant in Obs and Gynae, trust registrar in Obs and Gynae, then junior or senior clinical fellow in Obs and Gynae. Then the salary range for the consultant in the UK is, this salary range is from 105,504 pounds to 145,478 pounds per year. For trust registrar in the NHS, it ranges from 49,909 pounds to 61,825 pounds per year. For clinical fellow, Obs and Gynae, the pay scale would be 46,324 pounds to 71,814 pounds, depending on the nature of the job, depending on the employer. Sometimes they just provide with you some extra wages. So it depends to which trust you are going to apply, but the range is similar. Okay, so the last slide, this is the last slide from my presentation, which is regarding the global opportunities for MRCOG doctors. By now, we have discussed about the UK job opportunities and how we can enter into the UK. But now you can see if you have MRCOG, how many career pathways are open for you, how much opportunities you are going to have due to the nature of the MRCOG's global recognition. So it is highly recognized in the UAE. You will get a job of specialist or consultant. In Kuwait, yes, it is highly recognized. And again, if you have MRCOG, you can apply for the specialist or consultant level job in the Kuwait. Then in the Saudi Arabia, yes, it is again highly recognized and you can apply for specialist or consultant level post. Same goes for the Qatar. In Australia and New Zealand, I want to emphasize here, it is partially recognized. By that means there is a pathway for Australia and New Zealand, which is known as competent assessment pathway. In competent assessment pathway, it is classically for those doctors who have their specialty done. And for that, they would highly consider those specialists who have done MRCOG. And once you can apply through competent assessment pathway, maybe in Australia or New Zealand, they both have the similar pathway. They will grant you with the provisional license to practice in the Australia or New Zealand. Am I clear so far? Is everyone clear? Yes, Nayab, you can work in Ireland after MRCG. Yes, MRCOG is also recognized in the Ireland. Okay, so Australia and New Zealand, why I'm highlighting these two countries, because there are a lot of vacant slots for obs and gynae. So they need obs and gynae doctors, and the pay scale is way better than UK. So this is another opportunity for you. Once you have your MRCG, you can apply through competent assessment pathway. And once they approve you, they will provide you with the provisional license to practice in Australia or New Zealand. And once you are in their clinical system, later on you can get your full registration according to the policy of the hospital you are working. Then Ireland, yes, it is recognized. I understand the Ireland has their own specialty, which is MRCPI, but MRCOG is equally recognized. Then UK, we have discussed about this. Then we have another option of Malaysia and Singapore. It is recognized, but conditional on the conditional basis. It depends on your luck. Maybe you apply for the job and they need a doctor, so they can. In that case, if the employer hires you, they will easily approve your license and you can start working in Malaysia or Singapore. So this is a little overview of the global opportunities, so that you can. I just want to give an overview so that you can take a sound decision for your future. Okay, Dr. Humaira, if you have GMC, if you are done with MRCOG and you have cleared your OET or IELTS, then simply you just need to make your account on TrackJobs and start applying for the jobs. But yes, later on, we maybe if many of the students if they ask us to do a session on how to build our resume for MRCOG candidates, then definitely we can do a session in which I can highlight what things are needed. You should keep in your hands before applying for the jobs. So this is it. Thank you so much for being with me so far. If you have any questions, you may ask me anytime. I will be here. Now, I think there are many candidates who are waiting for the PLAB route. They want to know the insights of the PLAB route, what kind of challenges, what things are expected on this pathway. So I'm handing over my mic to Dr. Jeevan. Dr. Jeevan, are you there?
Thank you, ma'am. Yeah.
How are you?
So I want to present this one. So
okay, let me stop sharing my screen so that you can share it.
Okay, all right. Yeah. Okay, thank you, ma'am. So here. Can you see the screen now? Are you able to see?
Yes, it's clear.
Oh, yeah. Okay, right. Okay, ma'am. So good afternoon and good evening, everybody. Hope it is audible also. So, thank you, Sumbal ma'am, for introducing me, but I just want to make a few corrections in that because already I am in UK, but I haven't got my GMC registration completely because I cleared OET and PLAB 1 in the first go, but couldn't do that in the PLAB 2 session. I am going to try that again. But since I have this opportunity to go through all these pathways, OET, PLAB 1 and PLAB 2, I think I can give you some insights regarding this PLAB pathway. So I will be going through some introduction and the difference between PLAB and UKMLA. Nowadays, we call it as UKMLA. And a few words on the PLAB syllabus, the route, the cost involved, and the current job market, which are tricky right now, actually, and the career growth after the PLAB. So you have already know that MRCOG is one method to get the GMC registration for the international medical graduates. And we have this PLAB pathway also, and you will see what is the difference between these two pathways, between the PLAB and the Royal College examination. So we will see which pathway aligns with your career goals. And you know, as being we are all international medical graduates aspiring to work in UK, obtaining the General Medical Council registration, and that is our first crucial step to do when it comes to the PLAB pathway. That is the Professional and Linguistic Assessment Board. Okay, so PLAB is called as Professional and Linguistic Assessment Board. And the other pathway includes the Royal College exams. And as ma'am said, we have the MTI sponsorship, and sometimes we have the CESR pathway, now called as portfolio pathway. And so many other pathways are also, which are not so famous pathways, but the most common pathway we follow is the PLAB and the Royal College pathway. While both routes lead to GMC registration, they differ significantly in terms of exam structure, cost, duration, and career progression opportunities. So this presentation enables IMGs to make an informed decision based on their career objectives. Already you know now about the MRCOG pathway. Now let us see about the PLAB pathway. So PLAB, as I already said, it is the Professional and Linguistic Assessment Board, PLAB. It has got two parts, PLAB 1 and PLAB 2. And we have now from 2024-25 period, they are slightly phasing it into a new terminology called as UKMLA, that is United Kingdom Medical Licensing Assessment. Okay, so we have the PLAB, and now it is becoming UKMLA. So, but very recently also they were having this paper-based PLAB 1 examination and the OSCE-based PLAB 2 examination. But slowly they will convert this PLAB into UKMLA in the future. So coming to PLAB, many of you may be knowing it has got two parts like PLAB 1 and PLAB 2. PLAB 1 is a paper-based MCQ examination, and PLAB 2 is a practical examination. PLAB 1 is called as AKT, that is an applied knowledge test that focuses on doctors' ability to apply their knowledge to patient care rather than just recalling facts. You know, I am coming from India. So we have, after our primary medical graduation, that is MBBS, we have this postgraduate examination called as NEET PG, which is very much based on the facts and figures that we have to memorize and we have to recall and we have to try to answer that in the examination. But this PLAB, I have written both PLAB 1 and NEET PG, so I know the difference. So the thing is, the PLAB 1 is comparatively easier when compared to the examination in our countries, like in Indian subcontinent. So that's one thing. And in PLAB 2, we have this OSCE, that is a practical examination. OSCE stands for Objective Structured Clinical Examination, that assesses clinical skills, especially how you approach the patient as a safe doctor. That is what they are looking for, and the GMC. And they will see your interpersonal skills, your clinical skills, your medical knowledge, your communication. So it is not a tough one, but it needs some practice. No, not some practice, real practice is required. Then only you can clear PLAB 2, but it is very much doable examination. The pass rate is around 60% to 70% of PLAB 1 passed candidates pass their PLAB 2 in their first attempt or in their second attempt. Now, UKMLA is very much similar to this PLAB examination. It also has got the first part, that is the AKT, an applied knowledge test that focuses on doctors' ability to apply their knowledge to patient care rather than just recalling the facts. And the OSCE examination, they have renamed to CPSA, that is Clinical and Professional Skills Assessment, involves practical scenarios similar to the OSCE practical of the PLAB 2. So it is, although they are changing the names and changing their syllabus a bit like the PLAB pathway has the syllabus called as PLAB Blueprint, and now it has been changed to UKMLA content map. But essentially, all the contents and the medicine itself, it is not going to change much. Only some certain terminologies is getting changed. CPSS stands for Clinical and Professional Skills Assessment, which essentially is similar to the PLAB2, that is the practical OSCE examination. Now, whom are PLAB and UKMLA for? For whom we are doing this PLAB or the UKMLA? They are for those people for having their early careers in their path, like early career progression, designed for international medical graduates who wish to start working in UK as soon as possible after their primary medical graduation, that is MBBS. Well, it's a licensing examination. So as Madam said, it is not, the MRCOG is a postgraduate qualification, whereas PLAB is a licensing exam that solely facilitates GMC registration. We will not be getting any kind of qualifications after that, only the registration, that is the GMC registration. We'll get a number. And this leads to the junior level NHS roles, that is FY2 to ST3 level. I will explain all these terms. It's a bit confusing. So many terminologies are there in NHS and in the UK medical system regarding the roles of the doctors, but we will try to find out the answer. We'll try to simplify it and let us find the definition for each role. Anyway, this FY2 stands for the foundation year 2. That is after your internship, FY1, which is, we all have like 1 year internship back there in Indian subcontinent, but in UK, they have this 2 years of internship that is called as the foundation year 1 and 2. So since you have, when you get your GMC registration after your PLAB 1 and PLAB 2, essentially you will be giving them evidence of your internship or the house job, we call it as, or house surgeon job. Many terminologies is essentially the same. And then they will give you the full registration, and you'll get the full GMC registration, and you can work at any level of that is equivalent to FY2 till ST3 level maximum. So these are the junior roles that you are going to do after your GMC registration. And it is faster and cheaper than MRCOG. We will see how the timeline and the cost involved, but offers less career advancement initially compared to the Royal College examination. So if you are a person who is having GMC registration and if somebody else is having full MRCP or MRCOG with them, obviously the job employers will be preferring, or they will be having an edge. The candidates with the Royal College examination completed will be having an edge over the just a person with GMC registration or the PLAB pass person. Okay. So far so good, all of you. Let me see. Okay. All right. So next slide. Why is it not moving? Yeah. So this is the overview. We have already seen that the purpose is for the licensing purpose only, and we have many roles related to the foundation year 2. And SHO stands for senior house officer, and then we have the trust grade. All are different types of names given for the doctors who are in non-training jobs, and they will be doing jobs after their GMC registration completed. And the timeline for both PLAB 1 and PLAB 2, if you are doing it in a go, even if you are working also, not so hectic work, then you can complete both the parts of the PLAB in like 6 to 12 months maximum. Even if you are working also, you can study the PLAB examination using, there are a lot of information and materials available offline and online. You have got certain question banks available online from different people. So you can select at least one of them and stick to it, and you can do your study diligently and you can clear this examination in a single go. The only difference from MRCOG, there are many differences, but one difference I want to point out is that to write the PLAB 1, initially you have to clear your English language requirement, that is the OET or the IELTS has to be completed. Then only you can apply for the PLAB 1 examination. And another requirement is that you should have completed your final MBBS examination. You need not complete your internship for applying for the PLAB 1 examination, but at least the final year examination should be completed and the name of your medical college or medical school should be there in the list provided by the GMC. It should be recognized by the GMC. Then only you will be able to move forward and apply for the PLAB 1 examination. So it's a comparatively faster route compared to the MRCOG, and the cost involved is also comparatively less. So these are some of the terminologies that we may be using when you come here and join NHS, join the UK medical system. You will be having the initial job will be like starting with FY2 since you have completed your internship. After completion of internship only, you will get the GMC registration. I want to make sure this difference once again. For writing the PLAB 1 examination, you need not have your internship completed. But once you complete PLAB 1 and PLAB 2, and when you're ready to apply for the GMC registration, they will definitely ask for the internship completion certificate, and you have to provide that. Then only you will get the full registration. Otherwise you will for the PLAB examination, there is no age bar as of now, but I don't know about the Royal College, ma'am. You may.
There is no age limit because mostly the postgrad exams are mostly taken up by the consultant. So there is no such age limit.
Thank you, ma'am. Yeah, so that is the thing. You can write your examination at any age so far. And yeah, so coming to the like the terminologies of doctors, you can see here. FY1, that is your first year of house surgency or house officer or house job, and FY2 is after that you will be coming and doing the job here after getting the PLAB 2 and GMC registration. Then you have the core trainee and specialist trainee job positions, and just all the terminology was like senior house officer. And then comes the specialist registrar and registrar positions. Nowadays it is called as specialist trainees and specialist registrar. Then after completion of your specialization, you will be given the certificate of completion of training. Then you can apply for the position of consultant. And GP is almost similar to the position of consultant. For that, you need to complete your foundation year 1, foundation year 2, and then you should apply for the GP training. And before that, you may have to take a certain examination called as MSRA examination. I'm told about that. And then only you can, you'll get a ranking and you'll get the post of GP training. And 3 years of GP training, you will become, you have to complete the MRC GP examinations, and then you can become the general practitioner after applying to the to get your name in the registry. So that is one pathway. There are so many pathways are out there, but we are not going into deep because we will be concentrating on the PLAB pathway only. And these terminologies, so where we have the junior doctor, senior doctor, so many terminologies have been used now. But recently, the British Medical Association, they came up with the term resident doctor for the junior doctors, so that there won't be any problem with the terminology among the common people. So even if you have this training FY1, FY2, CT, and you had all the specialist training till specialist training 9 years. So you may be going on training for 6, 7, 8 years, and still you will be called as a junior doctor. So that doesn't sound good, right? So they have come up with a new term, resident doctor, for these doctors, junior doctors. And when you become a consultant, you definitely become the senior doctor in the system. So then sometimes when you apply for jobs after passing the PLAB 2 and getting the GMC registration, that is maybe after 6 months to 1 year, when you get the GMC registration, you will start applying for jobs. The thing is that some jobs will be having this requirement of NHS experience as such. Nowadays, it is getting a bit tougher to get a job after getting the GMC registration through the PLAB route. They are even asking for the at least completing part 1 and part 2 of the Royal College examination. Apart from the GMC registration and PLAB 2, they are also sometimes they may even ask for visa status of the such a candidate in to get a job in UK. But so they are actually slightly they are trying to get the British medical graduates having to have an upper hand than the international medical graduates. So it is the only some the talks and the discussions are going on. It is nothing is concrete as of now, but uh, the situation is getting tougher nowadays to get a job after the PLAB. I have to say that it is not to discourage you, but to know to make sure that you know the situation, current situation in United Kingdom. And let me see any questions so far. Yeah. I'll be coming to the attempts that you can do for the PLAB 1 and PLAB 2. And is there anything for MRCOG to like number of attempts that Madam can give you an idea? Yeah.
Okay, let me
Yes,
check the question.
Yeah.
Okay, Dr. Muna. First, I have done a detailed session on the topic of how we can enter into the training program if we are going to choose obs and gynae. So actually, this is a very, you may say it is a complex procedure. So one should be fully informed in order to take the informed decision. So classically, there are two pathways if you want to enter into the training pathway. The first one is if either you want to enter at the ST1 level, which is the specialty training 1 year, which is a very junior in the basic level. It is a foundation level of training program. Then the second pathway, if you want to enter into the training program, then that is the ST3 level pathway. So the prerequisite for the training to enter into ST1 level is quite different from the ST3 level. Similarly, the criteria would be different, eligibility criteria would be different, the number of clinical years or you may have prior starting the training, it is also considered when you apply for at ST3 level. So there is a lot of information, but yes, for both pathways, you need to sit in the MSRA exam. So I have done a detailed live session. The backend team would provide you with the link of that session. Whenever you have time, you may watch that video because it is not possible for me to summarize that 1 hour session into 1 or 2 minutes. So.
Thank you, ma'am.
Thank you so much.
So moving forward, yeah. So again, the same thing. The junior level loads after the PLAB route, apply for the specialty training after gaining experience. So the thing is that even though if you get a job in United Kingdom, you can you need not stop there. You can after 1 year of NHS experience or 1 year of UK medical experience, you can definitely apply for the training jobs after that. And you can write the MSRA examination and go for the jobs training after that. Even without MSRA, I think the IMT and pediatrics, I think they don't require MSRA, it's in. And IMT is internal medicine training, okay? So, but for others, like for the GP, for the psychiatry, for radiology, everything you require to clear the MSRA examination. It is like again, it's a topics for another discussion. Maybe those who are cleared the MSR examination can give more idea about that. And that's one thing. So and when you start from just from the PLAB and you are trying to move up the ladder, you may take up to 8 years to become a consultant, going through all those training years. So it's a long pathway compared to MRCOG to get a post of consultant. Okay. Again, the salary will be towards a lesser side compared to MRCOG, obviously, and but it is enough. If you are coming as a single person here, I think it will be 32K or 44K is enough. Even after the taxation, you can live. But the cost of living here, since I'm here in UK, it's on a higher side compared to our Indian subcontinent, and we may have to shell out a lot of money for the purpose of renting and other expenses, bills. So you have to have this in your mind when you're taking the PLAB pathway. The initial salary would be in and around like 40K only, and you may have to budget your expenses. Okay, so that is one thing. Another thing is that, as ma'am said, you will get a good salary, a handsome salary when you are done with the Royal College examinations and when you become a consultant later on after training and all. But again, you should know the tax system in United Kingdom is it's very they take around 20 to 40% of your income out of your salary, depending upon your income. So that is one thing you should keep in your mind. It's not like Gulf country, UK. You need to be very careful when you choose the pathway. But the training you get here, it's like state-of-the-art training, and you will be having. You can go to any country after that. After the training here in United Kingdom, like you can go to the first world countries or the Gulf countries, or back to your country itself, and you will be having a better understanding of the system, and you will be getting a better remuneration, hopefully. And one more thing, those who want to go to Australia after coming to UK, you can do that after 1 year of experience you have here in NHS. You can definitely go. Pathways open to Australia. You can get the AFRA registration easily to Australia. And after passing PLAB 1, if you are interested to go to New Zealand, you can go there, and right there, the New Zealand's practical examination called as NZRZX and REX, and you can get the registration there in New Zealand. And we have a Trans-Tasman agreement between New Zealand and Australia. So if you are interested, you can even use the registration there in New Zealand to get AFRA registration there in Australia, and you can go by that pathway. So many pathways will be open after you pass the PLAB examination. Even PLAB 1 is accepted in Qatar, just PLAB 1. You need not write the or MOH examination of the Qatar, and you can do that even after PLAB 1. But completing PLAB 1 and PLAB 2 and getting the GMC registration, it's a comparatively easy process, and it is less expensive and fast process. So I recommend you to do that if you are interested to go directly to UK as fast as possible after your graduation and internship. Then you can definitely go for the PLAB pathway. Otherwise, as madam said, you can take a bit of time, and you can utilize your time, and your input should be there, your energy. You can do that, your Royal College examinations also. So the PLAB 1, somebody, yes, anybody?
But sir, what I've heard, basically, considering the current situation, whatever is happening in UK, it's like getting more and more difficult to get jobs now, as compared to like the already trained doctors and us as fresh graduates. So considering that, I also opt for the alternate pathways. Yeah.
Alternate path. Yeah. So the thing is that if you want something,
basically, Dr. Rian, what I've heard that people are saying that we still have to give AMC Part 1 and Part 2 as well without any NHS experience in order to.
Yes, that is right. That without 1 year of NHS experience, you may have to give the AMC Part 1 and Part 2 also.
But so what I'm thinking is that what good did passing PLAB 1 and PLAB 2 and getting GMC certified what good did it do to us?
Okay, okay. Yeah, right, right. So the thing is that coming, like we are starting, let us see, let us take case of one person, one doctor who is trying to come from, let's say from India. Okay, since I'm from India, I will give that example. So he completed his MBBS, 4.5 years of struggle and studies, and he is now eligible to write the PLAB 1. So he went and studied and cleared the OET. We need to have at least a score of 350 or band B in all 4 modules of OET, that listening, reading, writing, and speaking. OET or IELTS, it is you should get an overall band of 7.5 and 7 in each listening, reading, writing, and speaking modules of IELTS. So after getting this only, you will be eligible to apply for the PLAB 1 examination. So he filled out like around 300 pounds, near to 268 or 300 pounds of money to write to apply for the examination. Some around like how much in Indian rupees we call it as around 35,000 Indian rupees for the OET. So yeah, after doing this, he or she is ready to write the PLAB 1 examination, and he wrote the examination. He cleared it. Now he can, there are 4 attempts you can do once you have applied for the PLAB 1 examination. Yeah, so you got 4 attempts to clear it, and then you can write the PLAB 2 examination. For the PLAB 2 examination, this person from India or Pakistan or Sri Lanka, she or she has to now get the visa apply for the visa, stating his PLAB 2 booking, and then he has to gather money for his expenses. He has to go to United Kingdom to write the PLAB 2 examination, because PLAB 1 we have this examination all around the world, but PLAB 2 is happening only in UK, Manchester. Okay, the city of Manchester. The PLAB 2, we have 2 centers there, Street and Square. And in the Street and Square of Manchester, we have these 2 centers who is conducting the PLAB 2 examination all around the year. Whereas PLAB 1 is happening only 4 times a year, whereas PLAB 2 is happening almost every day all around the year. So GMC is making a lot of money on this, but the thing is that after all these your expenses, and when you have come to UK, you have applied for the your examination and wrote the PLAB 1 and PLAB 2 and passed, and now you can apply for the GMC registration using your internship certificate, your good standing certificate from your council, medical council. So many things are there for the GMC registration steps. That is beyond the scope of our discussion. But still, I'm telling you all this. And now you have registered with the GMC, and now you can apply for jobs in not only UK but also in certain Gulf countries, and this will definitely give you an edge over other candidates who are applying for the same position even in your country. So that is one thing. And being a GMC registered doctor will make yourself stand out. I mean, in your community, in your doctor community, you will be having that edge over the other people. So that is one important thing. Even though, as you said, after doing all these things, there is chance of not getting any job in United Kingdom. I have seen a lot of people, they are posting in the social medias and like they have been applying for a lot of jobs in UK since they have passed the PLAB 2 and got the GMC registration, but still there is no luck. So that is a hard reality now. Like in 2025, it was not like that a few years back, but now the reality is a bit harsh here in United Kingdom. So if you are going for the PLAB pathway, getting the job straight away without NHS experience, even if you do clinical attachments or such kind of things in United Kingdom after coming here on visa, on visiting visa or something like that, still they don't consider it as NHS experience. They are looking for people or doctors with NHS experience, even to start with the basic FY2 level jobs. And even I have seen that these jobs are asking for experience with MRCP or MRCOG Part 1, at least. They need this Royal College examination attempted. So that is the situation, Dr. Nasia. So that is Yeah, you are right in that sense. Yes. Any more concerns? So that is, if it is done, that is about the tough scenario here in UK after the PLAB pathway. But still, you should be hopeful. Because still there are doctors writing the examination and trying their luck here in United Kingdom. Let us see, and let us all be hopeful and getting into the non-training or training job in UK after the PLAB pathway. So PLAB pathway part 1 include 180 MCQs, multiple choice questions, and it is like paper-based examination. UKMLA will be computer-based examination, whereas PLAB 1 is paper-based examination having 180 MCQs for 3 hours. And PLAB 2 examination, it involves 18 stations. That is, it is an OSCE examination, objective structured clinical examination, where you have to go to UK, to the Manchester, either in square or in street. You will be having your center, examination center, and you will have to go around like 18 stations. 2 stations will be rest stations. So active stations will be only 16. 2 rest stations will be there. And if the examination will be over by around 3.5, 4 hours, because each session will last only for 8 minutes. In that 8 minutes, you will have to face the simulations or SIMMAN or simulated mannequins or simple mannequins or actively acting patient, those people who act as patients. There are no real patients out there, but these are the scenarios you may have to face in PLAB 2 examination. So yeah, let me see, some more questions are out there. Yeah, the salary is per annum. It is like if you are getting 32,000 pounds, it is per annum, not per month. So that's another thing. Yeah, the salary is per annum. Yes, I told you that the PLAB examination was based on the PLAB blueprint, and it was replaced with MLA content map, UK MLA content map, which outlines the knowledge, skills, behaviors needed for practicing in the United Kingdom. Therefore, it's important that you prepare using a question bank that is based on the UK MLA content map rather than the PLAB question bank based on the PLAB blueprint, because there is no much difference. Okay, that is okay. But updated question bank should be used for the preparation of examination. That will help you better. And even if the question patterns also is like, it is not just like any one-liner question or any factual question. It's not like that. The PLAB questions, PLAB 1 questions are made with scenarios. It will be having clinical scenarios in it, and with your own knowledge of like you studied for 4.5, 5 years in your MBBS, that knowledge is enough, and also some information based on the GMC's good medical practice and the UK medical system should be there in your mind. Then you can answer almost every question in the examination. What is best that I think after having this talk, you can decide by yourself. Even you can ask me about PLAB examination. I can give you information regarding that. And about Royal College examination, madam will give you information, and you have to make an informed decision based on that.
Okay, I actually didn't get the question. Selma, could you please more specify? Are you willing to give both exams, or are you relating to that you are able to do both exams? Okay, Dr. Sahiba, basically, if you have done MRCG Part 1 exam, yes, definitely it would help to boost your resume. Okay, Salma, if you have done FCPS, then definitely you should opt MRCOG pathway. Don't go for the PLAB pathway. Because if you follow the PLAB pathway, maybe it might take 2.5 years, maybe But if you just put some extra pressure on yourself, if you manage more time to study, in the same time period, like 2.5 years, you can also have MRCOG. So I think that would be a better option to get GMC registration. Dr. Salman, there is nothing to worry about. In the previous batches, we have many candidates who were really old graduates, and they, you trust me not, but they passed the exam with a very good percentages, ranging from 88 to 92%. I think we should share some feedback with you for your motivation, but it is absolutely possible. All you have to do is to just spend some extra time. Maybe if the fresh graduates, they are spending 3 to 4 hours every day, maybe you need to spend 5 to 6 hours every day. That's the only difference. But definitely you can do that. You can pass the exam. Thank you so much, Dr. Mona. Okay, what else we have? Okay, for those who are really interested to know how we can enter into training pathway in the UK, please you may ask the backend team for the link of that webinar. I have discussed everything in very detail, like what are the options, what are the prerequisites, what type of things you might need to have in your resume prior to applying for the knowledge, what are the limitations. So everything is there in that webinar. You might ask for the link. Okay, I did that, Dr. Mona. I have cleared my PLAB 2 exams and now I'm on the MRCG journey. Yes, there is nothing wrong with that. But if you have energy and you still have some time, try to be focused on one thing. If you are what I'm trying to say, if you have some plans to stay in your home country for maybe 2 to 3 years, then definitely take your time and go with the MRCG journey. But yes, if you want to rush your journey, you just want to move to the UK in a coming year or so, then the shortcut would be PLAB, definitely. But it depends on your priorities.
Vijay has raised his hand, it seems. Yes, Dr. Vijay?
Okay, what I explained that yes, MRCOG1 would help to boost your resume. For instance, if you have the license to practice in the Middle East, and there's some other candidate who has the license to practice in the Middle East, but that particular candidate do not have any post-grad exam, and you have that MRCG Part 1 exam cleared with you, then definitely you will get a privilege on that. Okay, all the 3 parts should be there. Once you have MRCG Part 3 cleared, the Royal College would provide you with the certificate, and that certificate is needed to upload for the GMC registration.
We can move forward, isn't it, ma'am?
Yeah.
All right, right. So I'll just make it faster because it's almost 1 hour. Let me see. Yeah. So the content map, the new one, the new UKMLA content map, it has 6 domains. Like it includes clinical practice, knowledge, capabilities, functional capabilities, and practical skills and procedures. Some of the procedures, the basic procedures you should be knowing. You may have to apply these your skills and procedures knowledge in the OSCE examination, in the mannequins, not on real patients, and the patient presentations, and all those conditions you have learned during your MBBS level examination will be asked, or it may come during the PLAB 1 or PLAB 2 examination. So that's about the MLA content map domains. You should be strong with these 6 domains, strong in these 6 domains to pass the PLAB 1 and PLAB 2 in a single go, or UKMLA in a single go. So again, you get 4 attempts to pass this examination. The multiple choice questions in PLAB 1 are related to the current best practices in United Kingdom and equipment that is routinely available in UK hospitals. So you get 3 hours to answer these questions. Each question starts with a short scenario. I have told you already. As an answer, you have to select the best option out of the 5 options you are given in the multiple choice question. Okay, so it is one choice only will be correct, and out of 180 questions you have 3 hours to answer the question. And the passing mark, it's not like fixed one, it is flexible. It depends upon the total scoring of the candidates in that particular session of examination. Right, so we'll just move on to the next point, that is the domains that I have already explained to you, and we can skip the slide. And about the PLAB 2, again, I told you it's a full day test. Like you will be having 3 hours, 4 hours time to complete this 16 to 18 stations. The 2 stations are rest stations. 8 minutes to complete each station. This is an overview of PLAB 2. So if you want to study a lot about the PLAB 2, we have a lot of academies here in United Kingdom and also back in some other countries like Turkey and in Pakistan and India and Sri Lanka also, I guess. But there are 2 school of thought on this. Like some people say you should go to an academy to study the PLAB 2 scenario. Some say you can practice by yourself with your friends and you can clear the examination. And both have worked, but still people try to go to academies here in United Kingdom after passing the PLAB 1 examination. So again, UKMLA is similar to the PLAB 1, and the CPSA, that is the OSCE examination, that is a clinical and professional skills assessment, it is similar to the PLAB 2. This will be it involves scenarios that reflect the real life settings, including a mock consultation acute ward. That is one difference I have noticed from the PLAB 2 examination. So we still have to see that in the real action. The CPSA for international medical graduates will be run at the GMC's Clinical Assessment Center in Manchester. CPSA will be similar to the current PLAB 2 examination. And previous slide, I just want to say that this AKT examination or the UKMLA Part 1 examination will be an on-screen multiple choice examination set by the GMC, which is the one difference from the paper-based examination of PLAB 1. Okay, so UKMLA Part 1 and UKMLA Part 2, that is CPSA. The MLA won't change the English language requirements. You still require this OET and IELTS to apply for the AKT examination. I mean, even if it changes from PLAB to the UKMLA, you still require the English language requirement. Okay, you have to still prove they have the necessary knowledge of English to practice safely in UK. That is what they are looking for. So the cost, like as of 2025, the PLAB Part 1, it is about £268. And for the PLAB Part 2, it is near 1,000, that is £998. And total cost will be coming in around 1,266, just the examination cost only. But still, it is lesser than to the Royal College examination, isn't it, ma'am? So it is, you can try, and even with your job itself, you can write this PLAB examination. That is the advantages of the PLAB examination, actually. So this thing, you can you know that you require the primary medical qualification to start the GMC account and a valid passport. You should have your address and email address with you, and the English language requirement also. And using your GMC online account, you can view available test days and locations under the My Test sections and book your PLAB 1 examination from there. You can take your examination in different parts of the country, world, and even in UK also. So that is the same thing. Pass rate is around 60 to 70% for both PLAB 1 and PLAB 2. It is very much doable. Whereas if you come to this AMC examination, Australian Medical Council examination, it is the pass rates of the clinical part of the Australian AMC part 2 is very, very less, like very, very low, like 20 or 30% only pass the AMC clinical. But in PLAB, it is easy to pass comparatively to other licensing examinations. So you may require 3 to 6 months of dedicated preparation for the part 1, similar for the part 2 also. And then we can say like by 6 months time, you can pass both part 1 and part 2 if you are passing it in a single go. Like if you pass the OET part 1, part 2 in a single go without any backlogs, and you can then pass it in like 6 months or maximum of 12 months, and assuming everything you pass in the first attempt itself. And you must complete the PLAB 2 within 2 years of passing the part 1. For the PLAB 2 also, you have 4 attempts, but you have to do that within 2 years. GMC just changed this thing like for 3 years. The validity of OET is only for 2 years, but they increased it to 1 more year and made it 3 years during the pandemic time. Again, they are turning it back to 2 years period for the OET and also for the PLAB 1 validity. Once again, I will explain to you. You have 2-year validity for OET. Within that 2-year validity, you have to write the PLAB 1, and you can write the PLAB 2 even if the validity of the OET is expired. There is not a problem. But when you apply for the GMC registration after passing PLAB 2, you should be having this valid OET or IELTS with you. And if you pass the PLAB 1, you have got 2 years time for you to pass the PLAB 2, and that within that 2 years, you have 4 attempts for passing the PLAB 2. If you fail in the 4th attempt also, you may have to retake the PLAB 1 again, and the cycle continues like that. If you got any confusion, this is the part where some people might get confused. If you can raise your hands or ask in the chat section, I will explain again to you. Otherwise, we can move forward. Yes. Yeah, study material. So I told you that there are a lot of materials available, like offline and even online also. If you search for the study materials of lab, you can get a lot of YouTube videos also. Everything is free stuff. But if you still want to go with the very latest questions and based on the UKMLA content map, you can subscribe for certain like our Med Institute itself. We have many others are also out there. You can make an informed decision because I am not vouching for any other institutions right now. So you can make an informed decision and you can consult with experts like Simbal Madam, and you can decide on which one you want to pick and study with. Okay, so that is about the materials. Another very important thing is that I had done my MBBS and a post graduation in pharmacology back there in India. So I lost my clinical touch. Even with a simple preparation of 2 months, I could pass the PLAB 1 in first attempt, and that too with working as a full-time working assistant professor in pharmacology. I was working back there in India. So that is the thing. You should be having the basic MBBS knowledge and a few knowledge from the UK medical system. Then you can even pass the examination with this information and with this knowledge only. But to know the scenarios and the question pattern, you may have to go and attempt the questions given in the question banks provided online and offline. You can do that, and you will definitely pass the examination. So the materials are the guidelines given by the UK. That is we have the NICE guidelines basically, and some other guidelines also available, and you can go through that. And even simply going through the NHS website, you will have all the very common conditions given there that is usually asked in the PLAB 2 scenario, and you can get the those explanation in very simple language, so you can understand very easily. And also you can definitely follow the NICE guidelines. And if you are in UK, you will be able to access the BNF, that is the British National Formulary, which is providing you information regarding the medications. I think outside UK, you have restricted access to the BNF, but if you are coming to UK, definitely you can access that also, and you can study all the systems that is having information with the UK medical system. So coming almost to the end of the talk, we can see that the pros and cons of PLAB: it is fast, it is cheaper, it is simple. Cons of PLAB, the job situation. The job market is kind of tricky nowadays, and you'll be getting only the junior level roles initially, and the progression is slower compared to Royal College examinations. So it is for the recent graduates. This PLAB is for the recent graduates, and those people, those international medical graduates who want things to be done very quickly and who are not patient enough, then they can go for this PLAB pathway than the Royal College pathways. So I have already discussed this job market. We have already discussed this thing. So it is while there is a general shortage of doctors in UK, securing a job, especially in competitive specialities and training programs, can be difficult. Factors like high application numbers, funding constraints, and workforce policies. So many policy changes are going to happen in the future, in the near future itself. So we have to be watchful, and we should always think about any other plan B if this is not working. This is not to discourage you, but thing is like that here in UK right now. So long-term career growth, you can become a consultant, but it may take a lot of time. And I'll just rush through this. These are the non-training jobs you can get after coming to UK after getting the GMC registration. Like the junior clinical fellow, this is the most common job that you may get after coming here. So like the first grade doctor, this is non-training position within the NHS system. Similarly, you have the junior clinical fellow also. And actually, by doing this non-training jobs, after 1 year, you can get your training jobs by writing the MSR examination. After 1 year only, you will be getting this opportunity. But if you are able to get your trust form signed off by your consultant, now also even from the clinical experience back there in your country is also considered for signing off the trust form, which is an essential requirement to write the MSR examination and go into the training position in UK after GMC registration. If you can do that, if you're successful, then you can go into the training jobs in UK. So about the trust form, etc., we require another session actually. So it is not going to be discussed here right now, but that is one option to go into the training job after the GMC registration, after PLAB route, through the PLAB route. Locum positions we can get, that is actually when it's a temporary replacement. Okay, so whenever the permanent doctors are going on leave or they are absent during those busy periods, they fill this position using the locum. They are the locum positions filled by the GMC registered doctors. Okay, one question. Clinic in UK, the NHS is the 80 to 90% of the system in health system in UK is covered by the NHS, but definitely there are private doctors and private clinics available in the United Kingdom, and it is possible, but the regulatory system is very strong here, and I am not sure about in depth regarding the regulatory system to start a clinic. So that may be scope for another discussion with some experts who have really opened a clinic after getting the GMC registration. Yeah. So yeah. So essentially, that is from me regarding the PLAB pathway. So I know it's a lot of information in such a short period of time, and of course, thank you, Med Institutors, for giving me this opportunity. And of course, Madam and the Med Institutors will be giving you of course, in down you can see the email and phone number. So Anytime you can contact them, they will guide you, and even you can contact them to contact information of mine. They will provide you with that, and we can discuss the further steps in pathway in the future also. Thank you so much.
Thank you so much for saving your time for us today.
Thank you, ma'am.
You're welcome. So if anyone have any question, you may ask us now. Otherwise, we will end the session. Okay, there's a question from Dr. Vijay that they have a clinical experience. They have done DGO, which is, if I'm not wrong, it is Diploma in Obs and Gynae. Please correct me if I'm wrong. DGO stands for Diploma in Obs and Gynae.
Yes, in India it is, that's right.
Okay, so Vijay have done DGO, and after that, he's working in a government hospital for 3 years. So please specify that, are you working in Obs and Gynae for the last 3 years? If yes, then I think I have already replied to this question. You might have a look on the assessment of training form. If your employer can sign your assessment of training form, then you can give it a chance. Okay, as sometimes RCG might ask for the logbook. Usually the doctors who are the trainees in the NHS, mostly they maintain their logbook. But for the IMGs, the criteria is a bit different. All you need is to fulfill the requirement of assessment of training form. Yes, if they find some area deficient, they might ask you for the logbook or any training certificates. Okay, please try to understand, since you are going to, if you are opting MRCOG, that means you are going to be a consultant, a specialty doctor in Obs and Gynae. So for that, you must have a sound clinical experience. Since it's a surgical allied, so you should have a hands-on surgical experience as well. If your job includes these things, if your job, the nature of your job is fulfilling this criteria, then yes, you are eligible for the MRCOG-3 exam. And for that, you need to provide them with the evidence that you have these clinical expertise. But if you are working in any other specialty, then I'm afraid to tell you that would not be considered as your clinical experience. Okay, is there any other question? Okay, I think we are done with the question session.
Hello.
Hello. Yes.
Dr. Vijay, madam.
Yes. How are you?
Ma'am, I'm fine. Actually, madam, in India, CPS DGO is a College of Physician and Surgeons. It's a course of actually it's UK course, but yeah, it's a MCI recognized course in India. I have completed 2 years continuous full-time CPS DGO course. After that, I joined government hospitals, sub-district and civil hospitals in India for 3 years. But it was due to COVID, it was not continuous, madam. For 11 months, for 6 months, it was in between gap. But I worked as a specialty DGO person, gynecologist, obstetric gynecologist.
Okay, so I get your question. What we can do for you, you may contact our backend team. We will provide you with the assessment of training form. And once you see that form, you would be in a better position to assess yourself that are you eligible, is your clinical experience is eligible for that? Because in that form, there are many criteria. So if you have a look on that, that would be better. And still, if you have any queries, any confusions, we are here to help you.
So thank you.
No problem. Okay, if Dr. Natalia, correct me if I'm wrong. Your question is if you are done with your MRCOG and you get your GMC registration, that means you are a consultant in the UK. Is that right?
Yes, it is so.
Okay. So let me tell you here.
We did registration for GMC, so fellow pass there. Will we be consultant?
Okay, Natalia, what happens once you are done with MRCOG? Yes, apparently in your home country you could be considered as consultant, but unfortunately, in the UK you would not be considered as consultant. Why? Because even the doctors who are training in the UK and they have completed that 7 years clinical training program, they need to follow another pathway in order to become a recognized consultant. For instance, for IMGs who have done MRCOG and they entered into training program or they just moved to the UK, they need to follow the CSER pathway. And by completing the criteria of that pathway, there is an exam and there is a resume, there is a prerequisite. If you fulfill that criteria, then you become a consultant in the UK. So that's a different thing. But yes, if we exclude UK from here and you have your MRCOG, then you can apply at the consultant level job in many, many countries. And from a few of that, I have already shared the slide in which you can apply for a consultant job in the Middle East, in Qatar, Bahrain, in Saudi Arabia, even in your own home country, and then in the Ireland, Malaysia, and Singapore, and even in Australia as well. So these are the options for you. But don't worry, if you have MRCOG, you have a sound clinical knowledge and you apply in a non-training job or a senior consultant equivalent job in the UK, you will get the equal pay as of the consultant who are working in the UK, because the pay scale is more or less similar for all the equal ranks. Am I clear so far?
Sorry, my internet was interrupted. Can you tell more about CSER pathway? Because is it long? Is it after fellow, before fellow? How it is? It is like a ST 6 and 7. How it is? Where it is?
Okay. Well, it is the most senior rank. It is above the ST level rank. For instance, if you have started your training at ST1 level and you have reached up to ST7 level, and by that time you are done with your MRCOG, I'm firstly talking about the trainees who are working in the UK. Then after that, they are eligible for they can become a consultant. They can apply on the consultant route. That is another journey. Similarly, the IMGs who have the MRCOG, they have the clinical experience in their home country and they met the criteria, they can simply follow the CSER pathway and become a consultant in the UK. So that's a different route. And I think one step at a time. By now, since you are just starting off your MRCOG journey, so try to focus on this journey. Otherwise, you would feel tired and exhausted because it's a never-ending journey.
One more question. My internet was very interrupted. Sorry.
No
Maybe
problem.
you spoke about MTI pathway. Is MTI for gynecologists possible? Because I saw in some MTI is not for gynecologists. Then RCOG say yes, you can apply for MTI. And if I still didn't pass MRCOG 3, but I passed 1 and I hope that passed 2. OET only also needed, and my experience less than 8 years, so it is okay. Does it have any limitation? Can I participate? Is it okay? And can I, after that 24 months of participation there, apply also for job there, not directly come back? Or it has strict rules that you have to come back, and if you want job, you have work in your country first? How it is?
In order for the MTI, the prerequisite would be different. It might be different from my home country than your home country. So first of all, you need to check from your home country, like what is the criteria for sending the doctors on the MTI route. And yes, definitely you will get a GMC registration on the basis of MTI. And as far as I know, there are many doctors who are done with their MTI program, and later on they apply for the jobs in the UK, or mostly I've seen doctors in the island. But yes, for they are that is also recognized for the MTI.
Why country is important? Because we apply from RCOG, we apply from that site, or it should be sponsored by country.
Okay, I will ask around. I will gather more information because I never followed the MTI pathway, so I'm not have much experience in that. But yes, I have noted your point. I will ask your concern to someone who has better knowledge regarding the MTI program, then I will let you know. Would be that fine?
Yes, thank you. I hope your session will be record will be possible to watch on YouTube, because I tried to enter at the beginning, but only now internet become okay. Sorry, I maybe do repeated question.
Don't worry, we will provide you with the session recording. Whenever you have time, whenever you have a good quality internet, you can watch later.
What about AOT? Is it AOT is okay for everything? So only one time I do AOT, and after if I want to apply for MTI or for job, they don't do AOT already.
Sorry, I didn't understand your question. Could you please repeat?
In assessment of training, they need assessment of training for MRCOG 3. So if they do it, it is okay also for MTI. I shouldn't repeat it, and also for job, I shouldn't repeat it already. For GMC, it is GMC also needed AOT, isn't it? Or it is they will use this AOT for MRCOG 3.
The assessment of training form, which is provided, which is available on the website of RCOG, it is classically used for the eligibility for MRCOG Part 3. So that is a customized assessment of training form just for the purpose of eligibility of MRCOG 3. You cannot use that form for any other application purpose.
Okay, thank you. Thank you.
Welcome. Okay, so do we have any other question? Okay, so if you want us to do another live session just like that, if you have any topic in your mind, if you have anything that comes to your mind, any pathway, any international, any other pathway other than the UK pathway, please do let us know. We can do another live session on that. Yes, there's a lot of saturation, but still people are getting job. All you have to do to understand the process, you need to assess your CV, you need to build your CV so that yours would be stand out, and your chances of getting a job in the NHS would increase. And yes, with the help of postgrad exams, your chances would definitely increase. No problem. Okay, so thank you so much for trusting us.
Thank you. Thank you, everybody.
And you are all are the future success stories. So let's stay positive. Goodbye.
Thank you. Thank you, ma'am. Thank you, my students, and thank you, everybody. And have a nice night or evening or afternoon, wherever they are. Yeah.